Hello everybody, and welcome again to another Friday evening when we talk matters reproductive health. We talk from an organization called She Chooses to Live, which is a non-governmental organization that is preparing and wants to give women knowledge, not just women, all people knowledge about reproductive health. The She Chooses to Live says that womanhood is our forte. We like to talk things women, men a bit, where sexual reproductive things are concerned. So we are coming this evening to talk about the anatomy of the female reproductive system. We've been writing a bit about it, and we thought for the people who didn't read, we can say something that they can listen to, and maybe they ask questions. Now, like I said, we are coming from She Chooses to Live initiative, which is has the mandate from the what is it called now? The NGO board to talk in 5 counties to educate women in the 5 counties currently. And we are making MOUs with quite a number of those counties so that we can go and talk to women and talk to men and talk to young girls about reproductive health, about reproductive issues, about female hygiene, about cervical cancer, about teenage pregnancies, things like those. Because we've noticed there is a lot of lack of knowledge over things reproductive health. And the fact that in our culture, people don't even like to think about it, leave alone to talk about it. And it's time we demystify the reproductive system, not in a vulgar way, but in a way that people understand it and people can know when something is wrong and deal with it. So yeah, that's what She Chooses to Live initiative does. My name is Dr. Jane Wakahe. I am a gynecologist, obstetrician by profession. I also have done public health, so I want now to go to the Wajikos or whatever else they are called in whichever county and talk to them about their well-being, and hopefully people will pick something and get to change their lives for the better. We want women to have holistic lives. Now, that doesn't mean that we will not be talking to the Princess Dianas of town. So that's what we are doing today for people who can afford to be online, to be able to watch YouTube. So that's what we are doing today. So on my left is the person I call my tech guy. Her name is Marion Wakahe. She puts me online and she removes me from online. So it's her duty. She's the technical person. Me, I have no idea about these new technologies. So yes, she's my tech guy. So today, like I said, we are going to talk about the anatomy of the female reproductive system. So here goes. At the end, if you want to ask some questions, we shall answer them. We'll have just a short presentation because we've been writing about it, just to sort of clarify a few things here and there, and then we can answer questions when it is time. So let's start. What is the female? When we talk about the female anatomy, what do we mean? And these are the organs that. My tech guy is dealing with me. These are the organs that make a female, that are unique to the woman and make her be called a female. So those are the organs that we are going to talk about. And what is the function of these organs? One of the functions is they identify one as a woman. They also are the ones that is the female reproductive organs that hosts the penis during sexual intercourse. It's also the female reproductive organs that produce eggs that finally become the human beings that are you and me. We were once an egg and a sperm. So the woman is the one who produces the egg. It's the female reproductive organs are the same ones that accommodate the baby when fertilization happens, and the egg implants into the uterus. So it's the female reproductive organs that host the baby, carry it to term, and finally let it through, and they are born as human beings. Then the other function of the female reproductive organs is that they produce the female hormones. They produce a hormone called estrogen and another hormone called progesterone, which are what are called the female hormones. And these female hormones are what promote the feminine look, the very beautiful female looks that women have, especially before they reach menopause. They also regulate menstrual cycle, these hormones, and they also support the baby inside the uterus. In fact, if some of these hormones are lacking, then the baby is not able to be supported, and they may not be able to grow well. So, having seen what the functions are of those organs, let's talk about them. And the female reproductive organs are divided into two. There is the first one called the external genitalia, which means, and the internal genitalia. Now, the external genitalia is that which, if a woman shows you herself, then you'll be able to see. So it's what you can see with the naked eye when a woman opens her legs. I didn't put a picture here because I didn't put a picture here. But anyway, that's what you see when a woman opens her legs, and these are the external genitalia. And what do they include? These structures include the biggest of them all is called Labia Majora, or big lips, or Labia Major. These are two big lips that are around just below the pubic bone, around and they close off the internal genitalia. So they are the first guard against anything going into the internal reproductive system, and they have also they protect. Their job is mainly to protect against any harmful things entering the internal genitalia, and them and their hair, the hair that grows on them, which is actually quite an important part of protection. The protection against any harmful infectious organisms going into the internal organs. So it is important that the labia major is present, and with all its hairs. Then there are two of them. They are quite big and they are quite prominent. They are two very prominent things. In my language, they are called the heels around Tumotomo, but that's my language. In English, they are just two labia major. Then there is what is the function? The function of labia, of the external genitalia, other than the protection of things going into the internal organs, is also that it's the area that hosts the penis during sexual intercourse. So that's it allows the connection between the outside and the inside of the internal sexual organs, which is at a point called the introitus. So that's part of the job. So to guard, again, to recap, the job of the external genitalia is to guard any harmful organisms going into the internal organs, and also to allow penis to penetrate sperm. To penetrate vagina and give hopefully the sperm that will fertilize the egg. Now, I want to say right here, before I forget to say it, that it's not absolutely necessary for the penis to penetrate the vagina, for the sperm to be able to enter the vagina. if somebody is doing heavy petting and ejaculation happens somewhere near the entrance of the vagina, the sperm are very clever. They will be able to swim. And I have delivered not one or two or three people who have not been penetrated by the penis, and yet they became pregnant. And some people also who, quite a number who we even have to open when we are delivering them, because the area is totally closed, and yet they did become pregnant. So it's not an absolute must that the penis must enter the vagina for the sperms to be there. So we talked about the components of this. We said one of the biggest one is the two lips called labia major, and they enfold the rest of the genitalia, the external genitalia. The thing about the labia major also is that they produce at menarche, when a girl reaches puberty, they have glands that become activated, and these glands will produce oil, and these glands will produce sweat. So you can imagine a mixture of sweat and oil if somebody is not bathing themselves properly. So ladies, please, we have to be very hygienic about cleaning the genitalia, the genital area, because it can smell awful. A mixture of sweat and oil cannot be a very nice smell. So that's the labia major, with its sweat glands, with its oil glands, and with its hair, and it guards the entrance of the internal organs like that. Then just inside the labia major is what is called the labia minor, or labia minora, or smaller lips. These are much smaller, they are much thinner, and they are different sizes in different people, and they vary in size, they vary in length, they vary in thickness. There are some societies I know of that have the tradition of pulling those labia minor to become longer, and this is if you see people from that community, then you find that their labia minor are even overflowing their labia major, which is not very a natural thing, but they do it for that is traditional reason. They have reasons for it, and it's done. So these two little lips, these two labia minor, they cover the vaginal opening, and they also cover the opening of the urethra. The urethra opens just above the vagina, and these are covered by the lips, the labia minor, the small lips. Then the other organ that is in the external genitalia is the clitoris. Clitoris is found where the two labia minor meet at the top there, where there is a connection between the two labia minor. And the clitoris is something quite tiny, a pea-sized organ that has even got a covering skin, which is called a prepuce, which can actually be withdrawn back like the male foreskin. So that's the clitoris. The main thing about the clitoris is that it has a lot of nerves, a lot of nerve endings. So it is very, very sensitive to stimulation indeed. Sometimes to the point of that, if it's overstimulated, it becomes very, very painful. I think when we were writing, we wrote a little bit about FGM, and FGM is female genital mutilation. And this means a mutilation, a cutting of the whole of any of the part of the external genitalia that I've talked about, from from the clitoris through the labia major, or clitoris only, or clitoris and labia minor, clitoris and labia major, and sometimes even closing up, so that there is a lot of mutilation around that region, and that is something that every human being should fight. I know it's cultural, but it's not one of the good cultures that there is. The other external genitalia organ is some two glands called the Batholith glands. They sit right at the opening of the vagina on each side, and their job is that they produce mucus, some mucus that is very useful for lubrication during sexual intercourse. Why I'm mentioning these, they are not things that you really see, but why I'm mentioning them is that a lot of people suffer what is called a Batholith cyst or a Batholith abscess. And what this means is that the opening, the outlet of the Batholith gland, which produces mucus, has gotten itself blocked, either by infection or by trauma. And because it's still producing mucus, it keeps getting bigger and bigger. And sometimes it ends up as just mucus in that cyst, in the gland. It enlarges and gets bigger. But sometimes it gets infected and becomes what is called a Batholith abscess. And we have to do surgery to open it up, a surgery that we call vascularization, to open it up. So that's the reason why I'm mentioning them. But it's not anything you're going to be able to see if you look with the naked eye. So that kind of covers the external genitalia. Now we go to the internal genitalia, the internal organs, and we start with the vagina. So between the external genitalia and the vagina is the area called the introitus, that is the entrance of the vagina. And then we go into this canal called the vagina, which is a very interesting canal. The vagina measures just about 10 centimeters long. I call it a tunnel, not even a canal, because it's like a tunnel dug somewhere. It connects the external genitalia now to the uterus, and at the top of it, at the end of it, dips the cervix. That is the cervix, the womb, the mouth of the uterus dips into the vagina, so that when having sex and sperm is ejaculated into the vagina, it is ejaculated around where the cervix is, and it finds it easier to swim from where the cervix is than to swim from outside. The vagina is also referred to as the birth canal, because that's usually where the baby comes through. In most deliveries, unless somebody is delivering through cesarean section, then the baby will come through the vagina, so it's called the birth canal. It's the one that allows the baby to come through. In my native language, we call it Jeramu Dhamaki, which translated means is the highway for the king. So that's what the vagina is. So it is kept lubricated at all times, basically, from when somebody reaches puberty and until menopause. There is always some sort of lubrication and discharge that is happening into the vagina, sometimes more, sometimes less, depending on the cycle of the time of the cycle of the month. I get a lot of statements that I'm having a discharge, that a woman says, I'm having a discharge, and I tell them, as long as you're in the reproductive age, you're supposed to have a discharge. So unless it is found to be abnormal, then it's supposed to have a discharge. Now the vagina can stretch to longer length. It has got grooves and valleys in itself. It's not smooth like it's not smooth. It's got valleys and gullies alongside its length, and it can stretch. It can stretch lengthwise, and it can stretch widthwise as it stretches to allow a whole baby out. So it's a very, very stretchable organ indeed. And it needs, once it stretches, of course, with the baby, it needs to be tightened again, because to bring those rings back again, so that it's a bit tighter. So that is the vagina, the connection between the outside and the uterus. Then we come to the uterus. The uterus is made of two parts. It's made of what is called the body of the uterus, or the womb, and then it's also made of the second part, which is called the cervix. The uterus in total is it looks like a pear. A pear, if you were to see it, it looks like a pear, the fruit pear, but it's hollow inside it. It's about 8 centimeters, by about 6, by about 5 or 4. It depends on sizes, and when one delivers, it becomes a little bit bigger than when the before delivery, and when we reach menopause, then it really shrinks. It does what is called atrophy. It becomes very, very tiny. So it depends on the size changes according to what age you are at. Now, if we talk about the body of the uterus itself, that is it's called the corpus or the womb. This is where implantation of the baby happens. And this is where the fertilization now comes. When the egg is fertilized, we shall talk about fertilization. But when the egg is fertilized, it implants. It lands in the uterus in a very nice sponge that had been prepared by the uterus to receive that very particular baby, in a sponge called the endometrial lining. So it lands there, and it is the job of the uterus to actually expand and accommodate this growing baby. Like I told you, the normal uterus before pregnancy is like 8 centimeters. Now this is a uterus that will grow to accommodate a baby who is about 53 centimeters, to accommodate somebody who is about 4 kilograms, and to accommodate somebody with a head of about 10 centimeters diameter. So it really, really does become bigger when one gets pregnant. So the baby implants, it is supported by the womb to grow, because the womb also makes the placenta that helps to nourish the baby when it is in the uterus. Now these muscles that grow so big when the baby is inside, they grow. Not only does the uterus grow bigger, its wall also grows thicker, which is a very, very miraculous phenomenon, because things tend to stretch like a balloon, but the uterus actually grows thicker as it grows bigger. So its muscles actually enlarge. And these are the same muscles when we talk about labor pains. These are the same muscles that really contract and push the baby out through the birth canal and out of the vulva and out into the outside. So that's the uterus. It's the same one that manages the menstruation. The endometrial cavity, if there is, the endometrium, if there is no fertilization, is the same one that brings out the bleeding. Now let's talk about the cervix. The cervix is a vital organ. It's found at the lower end of the uterus, and like I said, it dips into the vagina. So if when we are doing examinations, we are able to feel the cervix. When we are doing the pap smear, it's at the cervix where we take the pap smear. So we open the vagina and we see where the cervix is and take the pap smear from there. So the cervix is found inside the vagina, dipping into the vagina. It has a canal in it, the same canal that allows menstrual blood to come out, and also allows the sperm to swim out. When the cervix usually stays closed, except a very narrow canal, that one that allows only things like blood to come through, but it usually stays closed. And when it is that one gets pregnant, then the cervix is very vital in that it will remain closed. It will lock the fetus, it will lock the baby inside the uterus until such a time as the baby needs to come out. Now, it will only be opened, or should ideally, there are conditions where the cervix will open even before, but ideally the cervix should only be opened by labor. When it is time to labor, then the uterus, the contractions of the muscles of the uterus pull up the cervix, finally make it quite short. The normal length before labor starts is about 3.5 centimeters to 6.5 centimeters, So it is made to shorten completely and then to open wide. And it opens up to the level of 10 centimeters, and then it allows the baby to come through. That's what is called dilatation. So, so this is, again to emphasize, it's a very vital organ, this cervix. And not only is it vital in closing the baby inside, it's also the organ that gets affected by human papillomavirus and makes cancer of the cervix if the human papillomavirus, the high risk, does change it. So it's an organ that needs a checkup. It's an organ that needs to be taken care of. There are times when we have to, like if it gets the precancerous, the lesions before cancer starts, there are times we have to cut off a bit of that cervix, and then we have to tie, when somebody becomes pregnant, we have to tie the cervix so that it is like a purse string, so that it's able to hold the baby inside. But in natural times, the cervix does hold the baby inside until such a time as labor starts, and then it lets the baby out. Now, the other internal organ is the internal genitalia, the fallopian tubes. These are two tubes that hang from the upper sides of the uterus. They are connected to the inside of the uterus. If you go through the cervix to the uterus, there's a connection into the fallopian tubes. There are usually two of them, and they are about 12 centimeters long, about 4 to 5 inches long. They are important, these tubes. They are important in the sense that at the end of them, they do a funnel shape like this, and they hang around the ovary. So they don't hold the ovary, but they hover around the ovary. And when the ovary releases an egg, it is the fallopian tubes that suck up that egg and transport it towards the uterus. So they are important, that they should be healthy, that they should be indeed open. So they are very, they have inside themselves, they have very nice little hairs, like the caterpillar's hairs. And what those hairs do is that they, when they suck in the egg from the ovary, then the cilia, the hairs, they sweep the egg towards the direction of the uterus. And the direction of the uterus is the same direction where the sperm is coming from, because the sperm usually is poured around the vagina, swims up the uterus, actually comes up through the tube, and the fertilization happens inside the ovarian, the fallopian tube. So it's a very, very important organ indeed. So when fertilization happens, then the fertilized egg now swims, is again pushed through the tube towards the uterus, and goes to implant into the uterus. Now, if there is any trouble with the fallopian tube, and this movement of the egg, the fertilized egg, is impeded, this is what finally becomes an ectopic pregnancy, because once fertilization has happened, implantation has to occur within 2 weeks. So wherever the fertilized egg is found at 2 weeks' time, it will implant, because it needs nutrients, it needs to find a place to grow. So if the fallopian tube has a bit of a problem and doesn't allow the fertilized egg to go into the uterus quickly enough, then it will end up implanting into the tube, and that is a very dangerous situation called the ectopic pregnancy. So that's the fallopian tubes for you. Somebody is usually born with two. They are usually open. If anything destroys them, it's actually either infection from the vagina going up, or sometimes the appendix can affect one of the tubes because it's not very far from them. So people are usually born with two healthy tubes, and if there is damage, is usually caused by infection thereafter. So it's after delivery that it's after somebody is mature that the tubes can get blocked and can interfere with the flow of a fertilized egg. The other organ that we need to discuss, what the other part of the reproductive organs is the ovaries. Again, one is born usually with two ovaries. They are somewhere in the pelvis. They are not attached to the uterus per se, but they hang around there, and they are near the head of the fallopian tube. And these are the organs that produce the eggs that finally become the baby. There are two like oval-shaped organs. They are about 2.5 centimeters to 5 centimeters big, depending again on the time of cycle and on individual. But they produce their main job. They have two main jobs. They release an egg, at least one egg. We are now talking about normality, normal circumstances. They release an egg every 21 to 35 days. They usually will release one, but sometimes, as we know, they are twins or triplets, so they can release more than one. But usually, they'll start to manufacture many, but there will be one dominant egg that will be finally released. When a baby is born, when a baby girl is born, they have about 300,000 eggs when they are born. Before that, they have even more. They have millions and millions, but as they are being born, they have about 300,000. And whatever eggs one is born with, that's all you will get. It's unlike the sperm that are manufactured later in life. These ones, you are born with your number of eggs. But you hear there are very, very many eggs indeed. So when a fetus is born, when a baby is born, there are about 300,000 eggs. But by the time a girl gets to start her periods, then one has about 300,000 eggs. They are born with about 1 million, but there is about 300,000 at the time of menarche. But out of these, only about 300,000 will be released in the lifetime of between menarche and menopause. Now, of these, it's like I like to think of it as the fruit. So when the fruits are on a tree, there are some very nice fruits, and those ones are the ones that will be released first. So by the time somebody is reaching menopause, it's not even that their eggs are finished, but the quality of the eggs is gone down, and hence the menopause is starting. Not only is the ovary reducing the hormones, but it's also reducing the number of eggs and the number of very, very viable eggs. So those are the ovaries. They produce the egg that every human being has been, an egg and a sperm. So they populate this world. The other thing they do is that they produce the female hormone, the estrogen and progesterone. It is their job to keep one looking feminine. From the time of menarche, one changes from the childish figure to the nice female figure that you see, and the skin that you see in a woman, and then until menopause, when again we change to the kind of women we see. So those are the ovaries, and those are their major jobs. So that kind of wraps up the reproductive system of the woman. we, like I said, we had written quite a bit about it on little snippets here and there. So I hope this one has helped to clarify some things. Now I'll call the tech guy so that we start looking at any questions that we may have. Tech guy, I see one question here, which I'll answer as soon as I call the tech guy. Tech guy! Anyway, the question here is that, is it possible to have regular periods and not be ovulating? Tech guy. Is it possible to have regular periods and not be ovulating? Does a low progesterone mean one is out, is not ovulating? Thanks. Now, in the natural, it is when you ovulate, then there is a signal that is sent to the uterus. If the egg is not fertilized, that you are not going to have a baby this time. So the uterus usually sheds the endometrial cavity. Now, if you are having, is it possible to have regular periods and not be ovulating? You cannot be having regular periods and be ovulating. If you are not using anything, I'll go into that. So the ovulation is what makes periods regular, because the uterus waits for the signal as to whether are we becoming pregnant or not, to decide whether to shed the endometrial layer or not to shed the endometrial layer. Having said that, one of the most regular periods that we get is when we give women pills. And then they are not ovulating. In fact, we put the ovaries to sleep so that they are not ovulating at all. But you see, that regular period has nothing to do with the ovaries. It is that they are being given hormones for some days, which are then withdrawn. And when the hormones are withdrawn, then they ovulate. And that becomes like clockwork. And like when it is ovulation, when the periods could vary with a day or 2 or 3. This one is like, we give you this amount of hormones, we stop it, and you get regular periods. So you can get regular periods if you are on the pill, but you will not be ovulating. But if you're not on the pill, you will be, if you're getting regular periods, you are ovulating. So that's one of the ways we tell people that if you're having fertility problems and you have regular ovulation, regular periods, then that means the most likely thing is not the ovulation that is happening. So it could be other reasons. Now, does the low progesterone mean one is not ovulating? Usually, yes. By the time the progesterone goes to a certain level of very low, then it means you're not ovulating. The ovary is not giving out. There's a surge that happens once you ovulate. There's a surge that goes up with the progesterone goes up, and it's the same one that tells us that we are now in the ovulation phase, and it's the same one that then goes on to support the implanted fertilized egg. So yeah, if the progesterone is very low, then you are unlikely to be ovulating. And that's one of the measures that we measure whether your fertility is there or not. Whether your fertility is affected or not by the levels of progesterone. That is the only question I can see. Can you see another one? Okay, good. That's the only question. All right. Like I said, we had been writing snippets on this one. I just wanted to clarify a few things. And to talk to you people, because I like talking to you people. I wish you could talk back. But yeah. But like I said, we will be going into the, is it called machinani? Yes, those areas to talk to women about cancer cervix, about maternal mortality, about girl sexuality, about HPV vaccine. I'd forgotten to say that about HPV vaccine, which every girl should get. So we'll be going to be talking about such things in as she chooses to live. That's what we want to do as the next step. Not just talking here, but also going there. So all of you are very welcome to go with us when we are going. You can come and join us and join the team. Yes. So we say bye-bye.
All right, bye-bye.
Bye.
Bye.